The goal of this presentation is to help providers understand the key element of documentation for critical care services. It will include how we define critical care and explain the reporting requirements for critical care services. We will also review some clinical examples to help you translate this information into daily practice. Critical care is delivered by a provider for a patient that has a critical illness or injury that will impact one or more vital organ systems with a high likelihood of imminent or life-threatening deterioration of the patient. It requires your direct personal management to support life or vital organ functions, and requires interventions based on your personal assessment and manipulation of the patient's condition. Critical care service can be provided in any location provided it meets the definition of critical care and all the documentation requirements. If these interventions did not take place urgently, the patient would likely have sudden, significant or life-threatening deterioration. There are many conditions that can lead to you providing critical care. CNS failure, shock, acute renal failure and respiratory failure are only a few of the conditions that can qualify for critical care services. This is not an exhaustive list. The key element when reporting critical care is your documentation. There are three components of critical care documentation. The first element is time. It is important to keep in mind that critical care is a time-based code. The time includes activities related to the care and treatment of one specific patient, including reviewing current test results, assessing the patient vital signs, and other time spent on a critical care unit or other clinical area caring for the patient. The second element is documentation of critical nature of the patient's condition. Your documentation should clearly indicate all the diagnosis and treatment options that you are doing or are considering when caring for the patient. Your documentation needs to support why the patient is critical and the nature of the condition. The final element is medical decision-making. In order to report critical care, your documentation must reflect a high level of medical decision-making. Document the status of all current diagnoses that you are treating or that impact your medical decision-making. Indicate each diagnosis and if it is progressing, worsening or unchanged. Avoid words such as stable or within normal limits when reporting critical care. If the patient is stable, reviewers may not consider them as critical. Remember, medical necessity needs to be reflected in your documentation for critical care. Ask yourself, why they are critical. What am I doing to actively treat the patient? Other interventions you are considering. When documenting time, you need to state the number of actual minutes you spent providing critical care. This time needs to be devoted to an individual patient, and should support your individual care and treatment of the patient. Standard time statements such as "I spent 45 minutes providing critical care to the patient" are not acceptable if used for every patient that you treat. In addition, the time needs to be specific. Watch for rounding up your time. If you round up for every patient that you provide critical care for during a day, you can end up documenting more time than you actually worked that day. Your need to be immediately available in the critical care unit. Phone calls off the unit do not count. Time not directly contributing to the care of the patient do not count. An administrative meeting on the unit or phone calls regarding other patients do not count.